Hey everybody. So one of the things that I believe is critically important when working in the regenerative injection space is this concept of treating pain generators and actually recreating the pain with patients. Not just during the actual injections, but also during the physical exam. And so I'm going to break that down here. So when I'm working with patients, there are kind of the big two things that I'm really looking for that give me confidence in my approach with that patient, and to be able to convey that to the patient is the ability to recreate their pain. So as an example, when we are doing our initial consult, right, I'm going to want to know the history. I'm going to want to know any surgeries. I want to know everything about their pain and their injuries, and then also all the collateral stuff in terms of the metabolic health, hormone health, all that type of stuff. But during the physical exam, my number one goal is to try and recreate that patient's pain with different muscle testing, orthopedic testing, nerve testing, palpation, a whole bunch of different approaches that then allow me to try and kind of triangulate. Maybe we take into consideration any image findings. So that way we have some guidance on what structures I need to treat. Because if my physical exam, so for example in the low back, if my physical exam shows me or directs me towards, hey, a lot of tests for the sacroiliac joint and its supportive ligaments and the superior and middle cluneal nerves, a lot of those are recreating the patient's pain, then those are the things that I'm going to want to go ahead and treat. So then comes the next stage, and that's during the actual injections. And so when I'm using my needle, I'm actually as well trying to recreate their pain. Now, this is usually done just when we are injecting into the damaged area. So for example, when I'm injecting into the sacroiliac joint, if that recreates their pain, then that's an additional piece of confirmation, or at least reassurance, that we're actually addressing the appropriate area. Now, sometimes we don't get that when we're treating nerves, especially when we're doing like something like a perineural injection therapy, where we're doing subcutaneous injections of whether it's PPP, whether it's 5% dextrose. But with nerve hydrodissection, we can definitely recreate pain. And actually, we just had that procedure yesterday where we did a brachial plexus hydrodissection and recreated the pain that the patient was having down into their upper arm, their forearm, and their hand. And so that is really, really important for me, because it helps me to come out of that procedure being able to discuss that with the patient, say, hey, I understand that procedure, recreated a lot of your pain. It was uncomfortable for you. However, that actually shows us that we were treating the right areas. Because you have to think about it like this. If you have an area where, a tissue area, right? So let's say, for example, our sacroiliac joint. You have that area that is already telling the brain, danger, 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 which our brain is perceiving as pain. And then you put a needle in there and some fluid, that is actually going to amplify that signal, okay? When you amplify that signal, the brain registers that as pain, and because of the brain mapping and the way that nerves and different structures refer pain, if that's the same area that causes them pain throughout the day, that can actually recreate their pain. So that's a really, really good thing. So if you are working with a pain provider and there's some form of manual physical intervention, so things like injections, you really want to make sure that they are taking the time to figure out what your pain generator is and recreate your pain before the injection, and hopefully recreate your pain during the injection, which can therefore help to improve outcomes. All right, everybody, thanks for listening, and I'll see you later.